A stye is an infection in your eyelid. It's usually an infection in the hair follicle where one of your eyelashes attaches to your eyelid. Sometimes you can get what's called an internal stye, where the meibomian gland, one of the glands inside your eyelid, gets infected. Then it comes to a head and produces pus, which is released inside your eyelid. But mostly it's on the outside. It can be on the upper or the lower lid. You'll usually get swelling, some redness, and it will be sore, but you shouldn't have any problem with your eyesight, and it shouldn't be pain in your eye itself. A stye usually settles on its own within 3 or 4 days. Even though it's an infection, you do not need antibiotics. We no longer give even antibiotic eye drops. However, painkillers can sometimes help if it's uncomfortable, or maybe a warm compress. It is important to avoid makeup and to avoid contact lenses while you've got a stye. In terms of preventing it coming back in the future, it is important, particularly once you've had a stye, to discard any mascara or eyeliner, things like that, that you used on your eyes before you had the stye. And do try really, really hard to avoid rubbing. I know it can be difficult. Now, very rarely, the time you definitely need to see a doctor is if you get an infection which spreads around the eye. Then you get significant swelling all around the eyelid, redness. It can often block your vision because the eye is puffed up, and you'll probably feel unwell and feverish. If that happens, very important, seek help urgently. But don't worry, it very rarely does.